The exact prevalence of lipedema is uncertain, but the estimates range between 10 to 17% worldwide. So what's certain is that disease is much more common than we think. So is there any way to tell if you have lipedema? In this video, you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. Lipedema is commonly misdiagnosed condition. Another name for lipedema is a fat metabolism disorder that affects mostly females, and frequently it's painful. Lipedema is a chronic condition that causes abnormal fat buildup, usually in the lower portion of the body. However, it can also affect the arms. So is there any way to tell if you have lipedema? There is no laboratory test to diagnose lipedema. So lipedema is a clinical diagnosis. Frequently you see a specialist, you read about the symptoms and you realize that you have those symptoms. So number one sign of lipedema is abnormal fat distribution. Usually females will report that they have normal torso size, however there is excessive fat buildup below the waistline. The legs affected by lipedema appear to be heavier and larger for the overall frame. Lipedema fat is frequently resistant to weight loss regimen, even to bariatric surgery or weight loss drug. Lipedema fat distribution is usually symmetrical, so it affects both legs or both sides of the body pretty evenly. There is a strong genetic predisposition for lipedema, and the individuals will frequently report that it runs in the family, that they've seen their mom, grandmother having similar problems, having larger legs, larger lower body. As I mentioned, lipedema is a painful fat disorder. It's not uncommon for the patients to report tenderness in their fat. Usually with any minor trauma or even pressure on the legs, they will experience some discomfort. Nobody knows exactly why it happens. However, there's likely a problem with the sensory nerves being overly sensitive, likely due to hormonal imbalance, and perceiving even light touch or light sensation as pain and discomfort. Lipedema fat is usually denser and more fibrous. I see that during my liposuction procedures all the time. It will appear that the fat in the lower portion of the body is very nodular, lumpy. It's not a cellulite, although it might appear like a conventional cellulite, but that abnormal appearance of the fat is frequently a hallmark of lipedema. Also, the skin overlying the fat will look lumpy. That orange peel appearance or oatmeal-like appearance of the skin overlying the lipedema fat can also be a sign of lipedema. The overall shape of the legs appear to be column-like. There is no definition. They appear like columns in case if the patient has lipedema. There is very little change in the shape of the leg towards the ankles. So in very mild cases of lipedema, the patient will report that they have thicker ankles. Feet are usually unaffected. There is no fat deposits or swelling in the feet. Patients with lipedema will frequently have poor circulation in the area, so the area might feel cooler to touch. Frequently, the patients will go see a vascular surgeon prior to being diagnosed with lipedema because they had significant heaviness in the lower legs. Also, there might be some varicosities, and they attributed that heaviness and the symptoms to the varicose veins, although frequently it turns out that majority of the symptoms come from the lipedema and not from the varicose veins. Also, in advanced case of lipedema, patients experience significant joint problems, joint pain, even advanced added weight and pressure on the joints can contribute to early osteoarthritis, and the patients frequently end up with a joint replacement surgeries. Another sign is easy tendency to bruise. Even with minor trauma, patients with lipedema usually develop significant bruising in the lower extremities. And the last thing I wanted to talk about is what's called Stemmer's sign. It's the sign named after the scientist who described it. Basically, if you can pinch the skin above your toes with your two fingers, that usually means the Stemmer sign is negative. So negative Stemmer sign is consistent with lipedema. If the Stemmer sign is positive, you cannot pinch the skin. That's a positive Stemmer sign. That's a sign that there's significant swelling and the fibrosis in the feet, and that's usually a sign of lymphedema, problem with the lymphatic channels. Although the two conditions can overlap, they're usually different in nature. The reason they overlap in advanced cases of lipedema, when you have late stages of lipedema, the pressure from the fat can actually affect the lymphatics and can cause secondary lymphedema. So it's important sometimes to intervene to prevent secondary lymphatic stasis and lymphedema, to prevent the fibrosis and problems from the lymphedema by addressing lipedema, usually with the liposuction. So I hope you found this video helpful. Please click the like button and subscribe below.